Before we bring on Dr. Raiter to chat, we will go through a little bit of relevant literature on the topics that we're talking about today, including women in medicine. So the first article here is a JAMA surgery publication from August of 2023. Some of you may have heard of this because it definitely made waves when it came out. The title of this study is Surgeon Sex and Long-Term Postoperative Outcomes Among Patients Undergoing Common Surgeries. So basically, the objective of this study was to see if surgeon sex was associated with 90-day and 1-year outcomes among patients who were undergoing common surgeries. This was a population-based retrospective cohort study conducted in adults in Ontario, Canada, and they were undergoing one of 25 common elective or emergent surgeries between January 1st, 2007 and December 31st, 2019. And analysis was performed in 2022. For the main outcomes and measures, an adverse postoperative event was defined as the composite of death, readmission, or complication assessed at 90 days and 1 year following surgery. And then secondarily, each of these outcomes was assessed individually. Outcomes were compared between patients treated by female and male surgeons using generalized estimating equations with clustering at the level of the surgical procedure, which accounted for patient, procedure, surgeon, anesthesia, and facility level covariates. So, essentially, over 1 million patients were included. I guess I'll be exact. So we have 1,165,711 people. 151,000 of those were treated by a female, and then 1,014,657 by male surgeons. Overall, 14.3% of the patients had one or more adverse postoperative outcome at 90 days, and 25% had one or more adverse postoperative outcome 1 year following surgery. Among those, 2% of patients died within 90 days and 4.3% died within 1 year. What the analysis found is that after accounting for patient, procedure, surgeon, anesthesiologist, and hospital characteristics, patients treated by female surgeons had lower rates of adverse postoperative outcomes, including death at 90 days and 1 year after surgery, compared with those treated by male surgeons. These findings further support differences in patient outcomes based on physician sex that warrant deeper study regarding underlying causes and potential solutions. And so, basically in terms of this broader context where this is a very pertinent discussion, women are historically underrepresented in surgery in the US, and in certain specialties like thoracic surgery, they make up less than 10% of the surgeon population. Despite this, they are still now making up over half of all medical school enrollments. And so there's still this pervasive culture where female residents in surgical subspecialties report harassment or discrimination by supervisors as just one reason of opting out. As surgeons, women are less likely to receive referrals, work on high complexity cases, and they have less operative time. They're also less likely to have leadership positions, and they leave academic medicine at a higher rate than men. And so, again, this study, it made big waves at the time, but to kind of look at what their analysis popped up in layman's terms, patients who were treated by male surgeons were 25% more likely to die within 90 days. And they were 24% more likely to die within a year when compared to patients treated by female surgeons. Similarly, patients treated by male surgeons were 5% more likely to be readmitted to the hospital within 90 days, and 4% more likely to be readmitted within the year. And with male surgeons, patients were 9% more likely to experience complications within 90 days and within a year. And so, researchers found that while in general the patients had better outcomes with female surgeons, female patients fare worse than expected, and they had higher rates of adverse postoperative events within a year when treated by male surgeons. So, there's a lot that's been discussed in terms of like possible reasons or ways that we can account for these types of things. But just an example of one possibility is that maybe female surgeons are discussing more like perioperative care, postoperative instructions, things like that. Patients may feel that they were more adequately prepped for like postoperative expectations or things like that. I mean, we don't know. More studies could be done in this arena for sure, but it's some interesting results that came out of that study. And even more broadly, there is evidence in literature that there are differences in care delivery patterns between male and female physicians across fields of medicine. Female physicians spend more time with patients and spend more time making shared decision-making decisions with their patients and things like that. So without further ado, we welcome Dr. Raiter on today. Welcome to this week's episode of Promising Young Surgeon. This week, Dr. Noam Raiter joins us to discuss her exciting life as a family medicine resident and lifestyle influencer, soon to be attending. Dr. Noam Raiter is a family medicine resident in Toronto and a masterful lifestyle influencer. She has truly done the impossible: make the life of a resident look glamorous and chic. Her followers are able to get a glimpse into the life of a medicine resident while also covering such universal topics for girlies, including female friendships in your 20s, living alone, finding beautifully aesthetic cafes to study in. I really admire the way that her content is this balance on a knife's edge between one's identity and life as a physician with their identity and life as a trend-setting young woman. I love that you're real about your medical career and don't sugarcoat things to make them look impossibly easy, which is very easy to do on social media. But even while keeping it real, it's great how you can make the hospital and scrub life also, like I said, aesthetically pleasing. Dr. Raiter has also just completed her board exams, so huge congrats are in order for that.
Thank you so much for having me. I'm so excited to be here and very honored by all your kind words. I'm looking forward to our conversations today.
Absolutely. Well, and so seriously, congrats on finishing boards. And, I know that you're just 1 month shy of basically attending life. So
yes, almost there in the home stretch, but very excited to be done.
That's such a fun time. Well, I'd love to just start by, taking people back to the beginning. How did you get into influencing?
Yeah, it's a great question. It really started when I was in medical school. I was in my first year still, and we were just sent home because of the pandemic. Classic story. So I was in my early pre-clerkship or didactic years of med school. So everything was virtual for 6 or 8 months before I started clerkship. And I had so much more time on my hands. And I've always really enjoyed both, expressing my creativity, but also social media. I was such a consumer of, other content creators and whether it was fashion content, food content, wellness content, that I really wanted to just explore that, for myself personally and to feel creatively fulfilled. But beyond that, it was being in medical school. I noticed, one, the importance of mental health as medical students and how little we were talking about that, at least in ways that were actually impactful and in ways that were actually making a difference in medical student wellness. I mean, we have lectures on wellness and things like that, but I really started to realize that, one, my mental health was beginning to struggle during med school, but two, that of so many of my peers around me and so many people who I saw and still do see as so successful and I look up to all the peers and people who made it to med school, right? But I can see that there was a bit of a discrepancy when it came to taking care of our mental health. And beyond that, I also noticed that there wasn't as much of an emphasis as I thought there would be on the mental health and lifestyle medicine for our patients and learning more about approaching patient care from a more holistic perspective. So I really set on social media to try to talk about those two things, one, of student wellness, but two, of, looking at patient care from a more holistic preventative approach. So that's kind of where I started in more so the wellness space. But over time, it kind of transitioned more to lifestyle. I started sharing more of my journey in medicine and more of myself, my personality, and grew my following. But that was the origins of it all.
Wow. Well, that's very interesting. No, and I appreciate you going far back and kind of explaining the initial impetus for it. I didn't get the opportunity to come across your content and follow you until you were a little bit branched out from even like that initial core wellness era. But like that's really cool. And it's crazy to think. So when you went to medical school, like when you got in and then like you did your white coat ceremony and you started, you did not know that any of this would lie ahead for you.
No, I have no family members in medicine, like no one's a doctor or a nurse or even anything like that. So, I mean, people told me like, oh, medical school is gonna be harder than you think. And I'm like, okay, like, sure. Like, what does that mean? But I didn't really know much about really, I guess it's the culture or the hidden curriculum, however you want to put it. But I think that's something you either learn from firsthand experience or if you're lucky enough for people to tell you in advance. And that was a huge part of the social media piece as well, right? I felt like if I could talk about my experience now to other people who don't have family members or friends in medicine to give them a bit of an insight and not from a perspective of regretting my decision or not being happy in medical school, just from a perspective of, okay, I see these gaps and these disparities. How can we, work towards changing them, but also letting people make informed decisions about what's in store.
I love that. To me, that exactly hits on the heart of like a lot of even what I try to do, with the podcast and with rethinking residency and stuff, because this is twofold. You've actually described like you want to be able to reach people at even the pre-med level because there's more we could do to kind of educate the next generation younger. Like, hey, is this truly what you want to get into? Like they don't talk about this in college or kind of in the pre-med formally as much, certainly nothing of the hidden curriculum. And not only that, but then there's also this other level of students who might just be right smack dab in the middle of it. Like they might be deep into their studies at medical school, on clerkship rotations, or they could just be in residency when they get to that point of kind of questioning or disillusionment and being like, is this really the best way for this system to operate? Is this the best way for me to learn? Is this the best learning environment? Is this the best even patient care and things like that? So it's great for those people to have a place to turn and almost like someone to help them walk them through it when they're in it. Like, yes, part of it is it would be great to reach younger people and say, look at what you're going to get into. Just seriously, and that way, if you still pick it and when you still pick it, that you are well informed. But then additionally, some people are just trying to get through day by day. And I think we can't do enough to give them resources to get through it when you're in the middle of it.
Yeah, for sure. And that's something that's been really important to me in posting on social media is not just posting, everyday med content that's maybe only interesting for people who are already in medical school or now in residency, but also just posting content that can maybe reach a wider audience as well of people who, again, are pre-med or even just, contemplating or honestly just curious at what life in medicine is like. Because as much as, yes, one part of it is people should, be informed of what they get themselves into and what being in medical school and residency is really like. I think also, I hope that in the future, we also start attracting more people to medicine, maybe beyond that traditional archetype of people who enter medicine, people who also, want to prioritize their work-life balance, want to approach medicine in a way that's more holistic or in a way that really prioritizes the patient first. And not to say there aren't tons of people in medicine who do already do this, but I think the, commonly a cohort you see in medical school, it's pretty, uniform in personality types and things like that. And I think we really benefit from people thinking outside the box. And we saw that in, over recent decades, so many more women are females in medical school and residency and people from other genders or, other sexualities as well. And that's improving the field so much. So how much more can we improve it if we also begin to humanize the field and attract lots of different kinds of people into medicine and to be physicians?
Absolutely. And I agree. There's a lot of literature we'll include, of course, in the show notes and everything about how female surgeons have better outcomes for their patients than male surgeons. A lot of this has been popping up in the literature in about the past year to year and a half. And so certainly there's a lot that we can look at that's even evidence-based, but it also makes logical sense. As the patient population is increasingly diverse, our workforce should reflect that as well. And diversity more than just in, female versus male versus non-binary providers and things like that. This is just really an important question, and I feel like I'm getting right into the meat of this, but I would love to hear how your life outside of the box, like as a medicine resident and influencer at the same time, has made you a better doctor. Because I totally agree with what you've said. Like these out of the box people, like non-typical physician archetypes, I just think that they bring a lot to the field of medicine. Like I think they offer a lot to their patients and offer a lot to the field and kind of make us all better. And so I'm always a huge proponent of that. And in your case, of course, you do have this like incredible perspective that most residents don't have access to. And how does that change? Yeah, your practice and you as a physician.
Yeah, for sure. I mean, I think there's so many layers to that. I think first and foremost is just having work-life balance, but also having things that I enjoy to do outside of work, having something to put my energy into that isn't just, academia or clinic, etc., is going to make me happier. And we know that when physicians are happier and healthier, they have better outcomes for their patients. We know that burnout makes you impatient with your patients and affects your clinical reasoning. So, I mean, I think in that way directly by just improving my own mental well-being, I hope it makes me a better doctor. And I can feel the difference when I'm taking care of myself and I show up to clinic versus when I'm not. But beyond that, being on social media, you're obviously interacting with so many people, probably more than, the human brain is meant to process. And I think with that one, it allows me to gain some of that perspective to interact with people in my messages and hear perspective of people, whether it's their experiences in the medical field as patients or as doctors, or it's people who are in pre-med and, what are they struggling with? What are they wondering about the medical field? And engaging with lots of different people with lots of different opinions, I think always just, opens your eyes in terms of how you can approach medicine in the way that's best for your patients, but also in terms of what changes should we be working towards in the medical field? What are people waiting for, looking for, hoping for, etc.?
That's great. That totally makes sense. As you're even going through all this, I'm kind of thinking of a third prong, which would be your time management skills must be phenomenal to juggle
They're
both.
working on it. Yeah, I hope so. But time management's definitely huge.
And so one of the things that I have liked, like in your content, you even have alluded to or talked about days, like let's say that it's a weekend day, and it's a weekend off, whether it's a golden weekend or not, you have a weekend day, that there's something coming up that you do have to study for, but you just don't necessarily feel like studying. What are kind of some of your tips and the way to get into the right headspace that you've used that have like helped you get there and, make sure that the environment's right and promote a studying environment?
Yeah. Something I realized as I was applying to medical school, because I was doing my undergrad degree and probably already, starting to get burned out. I think we all start undergrad or college like bright-eyed and bushy-tailed with so much energy, and by like the end of the degree, you're kind of starting to dwindle. And I noticed that, and I realized, well, I'm about to go into another degree, and following that degree is residency, and following that, there's always learning and work as a physician and work after hours, etc. So I realized that I really have to develop sustainable habits, or I'm not gonna be able to pursue this. Like if I'm gonna treat every exam like I treated those early exams when I was 18 in my first year of undergrad, I wouldn't be able to, stay up till 3 a.m. every single time, or to lock myself in my room with no distractions and write an essay all day or cram it last minute. So developing those habits as I was entering medical school was really important for me to be able to sustain that work ethic throughout. And that means a few different things. Sometimes one, not procrastinating, starting to work on things earlier, but two, also not staying up till 3 a.m., not beating myself up over, every last point on an exam, and just taking care of myself in the process. So all of that to say, I think my biggest tip for getting yourself to study on the weekends is one, don't put it off till the last minute, and then you don't have to spend your entire Saturday studying. If you start a couple weeks earlier and you do a couple hours each day, it can be a lot easier. And you don't realize how exhausting it is to work, full-time hours, if not more, as a resident, and then still have to study. So just pace yourself. But the other part of it is also just making it as enjoyable as you can. So instead of just locking yourself up in your room and, saying, I can't get out until I'm done writing this, go to a coffee shop, put on an outfit that you like, make a matcha, whatever it is, put some music on, study with a friend. It sounds cheesy, but like romanticizing the experience of studying, make it something that's enjoyable because you have to do it. And if you're going to spend your free time doing it, you may as well make it something that you can enjoy. And I think some of that is honestly just mentally reframing it in your head rather than I have to study of, I get to, go to a coffee shop and get my favorite matcha and study with my friend. And then after that, I get to take a break and, go to my favorite workout class or something like that. So yes, it sucks to start on the weekend, but I think a lot of it can also just be about like mentally reframing it and convincing yourself you want to do it.
Well, we definitely love reframing techniques on this podcast and talk about it a lot. And so I really appreciate that insight. And honestly, I don't control who's the queen of what, but I think that you're the queen of making that, just kind of that mental shift, going to a cafe, making it vibey, making studying on a weekend enjoyable. That's something that we can all access, like you're talking about, kind of like dress for success. Why not make it a little bit of fun? And then once you're all dressed up, you feel good, you love the fit, you're there in the cafe, you have your matcha, the vibes are good at the cafe, then okay, maybe some magic can happen and you'll get through your reading or your Q bank questions, whatever you're there to knock out. But I think that that's great.
Yeah, for sure. I think it's part of me posting on social media for myself, at least selfishly, is it forces me to do that. It forces me to, romanticize my life and make things pretty and aesthetic. And of course, that's not what matters at the end of the day. But for me, it's what I find fun. And now not everyone listening might want to, be a content creator or care to take photos of their lives. But it can be so easy once you're in exam mode or you're in medicine or just in any busy profession to think, well, if I even take, 10 minutes to myself to just do my skincare in the morning or put on a little bit of mascara or pick my outfit, I'm wasting time and not studying, and doing those little things to take care of yourself makes such a big impact. So love all that reframing stuff. I'm sure I need to learn more of it from you as well.
Well, certainly to even piggyback on that, I do think that I'll use the example of, I guess I was in medical school almost a decade ago now, which I don't love that for me, but it was a little bit ago. And at the time, selfies were just not that cool, selfies, setting up little photo shoots just to have fun, just because you love the fit. Very uncool. I was I'm married to the game. I love it. I just, I like to take selfies or, again, take care of my skin, have a fun fit, even if it's a fun studying fit, because that is one of the ways where truly I expressed myself during medical school. Yes, Instagram, was just a fun, side type of thing. But to me, it also was a genuine creative outlet. And so even if there is definitely some cheesiness to taking selfies or posting a selfie or being I want to remember this moment. Oh, I want to remember this sunset. If it does bring you joy, don't feel okay, a serious student, a serious physician wouldn't be taking, these kinds of selfies, photos and things like that.
Yeah, totally. I think in general, medicine aside, in so much of society, there's so much minimization of hobbies that are traditionally feminine, whether it's taking photos or doing your makeup or putting on a cute outfit. And that's not even looked at as a hobby, I think, for a lot of society. It's kind of looked on as a waste of time. Rather, if you were doing something maybe, I don't know, riding your bike or watching
woodworking,
a football game. That would all be totally fine in a way to express your creativity. Or if it was, more serious forms of creativity like painting or music or something like that. But why do we take away from, maybe your creativity is making your oatmeal look pretty in the morning and placing your chia seeds nicely on it. So just enjoy those little things and don't let people tell you it's a waste of time. If it brings you joy, it's worth your time.
Yeah, and like I will follow your chia seed account. Like I love food staging. I'm interested. Like I'm sold. So I would definitely, follow all of that. And yeah, I have a lot of girlfriends where their makeup game is incredible. You know, they're studying the YouTubes. They do it for relaxation. They do it for enjoyment. And um, I think that fortunately people are finally starting to come around and see the true artistry and I think like genius behind a lot of that type of stuff. But agreed. It's funny because historically you could be like, well, I'm going to go like fashion a chair out of this like lump of wood for 300 hours. And people will be like, wow.
Right.
Like,
yeah.
That's it. That's art and nothing else. Nothing the girlies are doing.
Yeah. It's unfortunate, but I do agree. I think there is a change in the conversation. And again, I think that starts by having different representation within medicine. And I don't think that's because there weren't always women in medicine who love to do these, again, more traditionally feminine hobbies. I think they just thought that they couldn't express that they were actually doing it or that they wanted to do it, or we didn't really have social media for them to be posting on it. So I don't think that it's necessarily even different people in medicine. I think people are just learning that they can embrace their individuality and their own hobbies or interests and still be respected in medicine.
Absolutely. Well, I'd love to hear about some of like the collabs that you've done that you're the most excited about or most proud of. Anything that comes to mind over the years now?
Yeah, I mean, I think anything where I'm working with any brand who, one, whether it's a product like I love and use every day, but more importantly, just finding brands and companies or organizations that I really align with their values and helping to, working together to spread messages that I agree with. I try to be really intentional with anyone I work with, but it's always just a really fun creative process to bring that to life. I don't know if I can think of anything specific off the top of my head, but it's always just, I don't know, really fun and a really cool part of this journey that I'm so grateful to do.
That's awesome. When you sometimes like do have a full day at the hospital and then you have like an event to go to that night, and you're changing from scrubs to, I don't know, event wear, do you ever feel like Lizzie McGuire? And also my second question is that too dated of a reference?
No, I love it. I mean, I always say, I guess kind of similarly, that I am embracing, my inner dream of being like Hannah Montana, because growing up, that was like my favorite Disney show. And I thought she was so cool. And I didn't think that my double life would exist in the way that it does now. But it's fun. I mean, it's hectic, but I think I've learned to kind of love some of the chaos and, doing my makeup in the hospital bathroom or getting changed in my car. But I think it's when you enjoy it and you have fun with the process and you love both of those careers, it makes it so much easier to balance it all.
I love that. Yeah, no, what you are like the Dr. Hannah Montana. That's great.
That's the goal, the dream.
So to kind of move back quickly to your medical practice and everything like that, can you walk us through some of just your decision making when you chose family medicine and as you were going through residency interviews and, you already were balancing both sides, both aspects of your career and these parts of your life by then?
Yeah, I mean, there's a few reasons why I chose family medicine. The first one is that I couldn't pick what I wanted to do. I really liked a lot of things, and I realized that I didn't want to pigeonhole myself into anything too soon. And I liked how family medicine gave me the flexibility to, one, do a little bit of everything, in comprehensive family medicine, but also focus and specialize into different things in different parts of my career, whether that might be women's health or mental health or dermatology or whatever it might be. So having that flexibility was really nice. And I realized that I'm not someone who feels like they need to know everything about just one thing. And I didn't need to be like the be all and end all. I like that I can send a referral if I don't know the answer and ask questions, ask the specialist. So I realized that sort of medicine and being more of a generalist was more up my alley. And on kind of a similar scope, as I mentioned earlier, in medical school, I really realized how important focusing on medicine from a preventative standpoint was to me, and lifestyle medicine. So that being exercise, nutrition, sleep, stress, relationships, all those things that really help strengthen our health rather than only dealing with disease were something that I was really passionate about. And I found the easiest way to do more of that was through family medicine, where you're doing so much more preventative health and screening and such. But finally, it was also I just like that I could have the flexibility to pursue social media on the side too. I mean, residency's been busy, of course, but now once I'm done, to work however many days a week I want or tailor the days that I have, and not just social media of just Instagram and TikTok, but whatever that might be in the future, and just have the flexibility to pursue those endeavors as well.
It totally makes sense. And what do you envision like this next era is going to look like? Kind of the post-residency era?
That's such a good question. I don't entirely know. I graduated in a month, and it's definitely very nice to be able to take a little bit of time off. It's been a while since I took a break, so I'm probably just going to take a step back for a month or two, travel a little bit, think about what I want those next steps in my career to look like, and try to figure that out. But I definitely know that I want to incorporate both patient care, but also endeavors outside of medicine that help me, explore my creativity, whether it's through my podcast, social media, writing, so on, and trying to reach a kind of a bigger audience than just my direct patients with some of these messages. So I still need to figure out exactly how I want to put that into action, but it'll be nice to take some time to really brainstorm and be intentional with it.
That sounds incredible. Well, and again, congratulations on your upcoming graduation, because that's huge.
Thank you.
You do travel a lot, like you're kind of a pro traveler. And so I'd love if you could kind of leave us with maybe like top 3 favorite countries, locations, anything on your list.
Oh, that's so hard. Places I've already been, you mean?
Yeah.
Yeah. Okay. One is definitely the Azores Island in Portugal. I went, I think, a little under 2 years ago. It was so beautiful. I loved it. And food and wine was really cheap, which is a nice plus to a very beautiful city or a beautiful island.
Okay, love it.
Where else? I love Paris. I've been a couple times. I need to go back again. I feel like I need to just move there for a few months and really embrace the city. So that's definitely up there. And I also loved Costa Rica. I was around Nicoya when I was there, and I did a yoga retreat there last year, and it was just amazing. I need to go back and spend some more time there.
Wow. Well, I love all your picks. I've been to Paris and Costa Rica, and yeah, I'm very Midwestern, so Paris never gets old. And how long was your yoga retreat?
It was a week. It was so nice. I need to go on another one. I need to rejuvenate.
Okay. Well, again, I need to be you when I grow up. So, thank you so much.
Yeah.
Oh my gosh. Well, thank you so much for coming on. It's always fun to chat with you and hear about your updates in your career, your Hannah Montana double life. That's what I'm going to call it from now on.
Oh, I'm flattered. Thank you. Thank you so much for having me. It's such a pleasure.
Follow me on Instagram at francesmei.md and at Rethinking Residency. Visit my website, rethinkingresidency.com, to learn more about resident physician stories and ways that residents can most effectively navigate the game of residency. I cannot wait to connect with you on the next episode of Promising Young Surgeon.